Hey guys, we're gonna do some spine segmenting, which is just getting your spine to learn how to move independently. The motion is small, but we want each segment, each vertebra to have movement. And when it doesn't, our spine will do a cat camel and it'll move as a block. So big chunks will move instead of individual segments. So this is aimed at trying to create that segmentation of your spine. We're gonna use something called a squash ball. You can use your finger just underneath to give your cue, or a squash ball, or something else, even like an eraser or something small or something that has some give. Don't use a tennis ball or anything that's too big. So this size is the most, or something small like an eraser or something like that. And what it's doing is each vertebra or spinal bone, we're trying to create this motion to get a little bit of blood flow, little bit of mobility, little bit of motion. We're doing it actively, so this is learning, reteaching your brain, and actually giving you active control over your spine. It looks quite boring. I'm going to show you it just a little bit and talk you through, but it's mainly just getting your spine to segment, push down, flex, and extend, okay? So I'm gonna lie down onto the mat here. I'm gonna pop this ball right centrally on the spine, so the center of your back on the spine in my lower back. And I'm going to lie down onto this. So I'm gonna move myself up and I'm gonna lie down. So it doesn't look like a lot, but what's happening here, my ball is just about here on my back, is I'm keeping my knees up to start. As you get better at it, you can have legs flat, but start with just knees up. And what I want you to do, we're not gonna tuck our pelvis, we're not gonna curl our body. I want you to engage your core to think about pushing and squishing that ball. So I'm gonna, on a count of 2, I'm going to engage and try and push my spine into that ball, almost like I'm just tensing everything to squish. Now I'm going to slowly come off. So I'm going to squish down and I'm going to slowly come off. One more rep here, squishing down and slowly come off. We then move to another level. So you can either move the ball up or you can just roll your body a little bit down. And we do the next rep. So again, I'm engaging all this to think about trying to squish the ball. But the key in your thought process should be in your mind, close your eyes and think about where the ball is touching, and that's the tissue you want to move. So my spine is touching that ball and I want to activate that back of my spine, squishing into the ball, slowly coming off. Squishing into the ball, slowly coming off. This spine segmenting can be done throughout your entire spine using your ball or using your whatever you have, so the eraser, or just pop your finger just underneath, that's fine. And I want you to do 3 or 4 reps at each level. If you have a really bad level, do more. So if your back's really tight or quite painful at one level, motion is one of the best things you can do. And this is such a small little motion that actually it's very, very good to get blood flow in and out, and it's very therapeutic. So you're self-mobilizing actively that spine and getting it movement. Movement is one of the best things you can do for pain and dysfunction, okay? So try each level. So slowly work your way up. The lumbar spine does 5 or 6 joints. You're gonna work into your thoracic. There's 12 vertebra there, so there's lots of joints there. And then you can even work up into that upper neck here. It's a little bit harder with the neck. Sometimes you need a bit of a bigger ball, but you can use a squash ball as well. And I want you to do the whole spine. So do 3 or 4 reps at each level. If you have an area of focus, then just do your lower back more or your upper back. But really, we should be segmenting our entire spine every day. Try doing that for a couple weeks. Honestly, it seems like, wow, this is boring. Nothing's happening. It'll just unlock at some point, a week or 2 in. Every day, do every single segment, and you'll just find that all of a sudden it lets go. Then when you go to do other activities like Pilates or roll downs or wanting your spine to flex and extend in almost any activity, you'll see that it has the motion. You're reteaching your brain back the motion it should have. This is getting that spine to do this motion that we should have. Great. That spine segment.